As a Jefferson County employee, your job is more than just a paycheck. The work you do each day enriches the lives and culture of our citizens and community, and we are appreciative. When it comes to compensation packages, the county strives to offer employees a choice in benefits. We believe in providing you quality plan options at low and affordable rates for you and your family that will support both current and future needs. So how exactly do benefits work at Jefferson County? When it comes to eligibility, if you are hired into a benefit-eligible position, you will be eligible for coverage on the first day of the month following your date of hire. In addition, many plans offer coverage for your eligible dependents, including your spouse, civil union partner, or domestic partner, your children up until the end of the year in which they turn 26, regardless of student, marital, or tax-dependent status, stepchildren, legally adopted children, a child placed with you for adoption, or a child for whom you are the legal guardian, or your dependent children of any age who are physically or mentally unable to care for themselves. It is important to note that when you enroll your spouse or any other dependent, you may need to provide documentation of their dependent status. Anyone found to be misrepresented as an eligible dependent will be removed immediately from coverage, and all claims will be reprocessed and declined. It is also important to understand that if you want your dependent to have medical, dental, or vision coverage, you must also be enrolled in that plan. For example, your dependent cannot have vision unless you are also covered under the vision plan. When it comes to signing up or changing your benefits plan, there are 3 instances when this can occur: within 31 days of joining Jefferson County as a new hire, during the annual benefits open enrollment period, or within 31 days of experiencing a qualifying life event. If you do not sign up for benefits during your initial enrollment period or during open enrollment, you will not be able to elect coverage until the following year unless you experience a qualifying life event. Qualifying life events include, but are not limited to, marriage, divorce, legal separation or dissolution of domestic partnership, birth or addition of an eligible child to your family, adoption or placement of an eligible child for adoption, death of your spouse or covered child, change in your employment status, such as leave of absence or changing from less than 20 hours to greater than 20 hours per week or vice versa, change in your spouse's work status that affects his or her benefits, your spouse's annual open enrollment period through his or her employer, or a qualified medical child support order. If you qualify for one of these events, you have 31 days to notify Human Resources-Benefits staff and provide proof. Change requests submitted after 31 days cannot be accepted due to IRS rules. These plan changes will take effect on the first of the following month, with the exception of newborns' benefits being effective on the day of birth. As mentioned earlier, the county believes in offering choice to employees when it comes to medical, dental, vision, and other benefits. So how does a medical plan work at Jefferson County? There are 5 different terms that are imperative to understand. A deductible is the amount of money you must pay each year for certain covered health or dental services before the plan will begin to pay. For example, in this plan there is a $500 deductible, meaning that for certain services like hospital services, outpatient, or mental health services, once you spend $500 out of pocket and hit your deductible, you pay a certain percentage of the bill while the insurance covers the rest. A copayment is a fixed dollar amount that you may pay for a certain covered medical or vision service. Typically, this payment is due upfront at the time of service. For example, in this plan, if you were to see your primary care provider, you would have to pay $10 upfront. Coinsurance is the percentage you will pay after you meet your deductible. For example, in this plan, if you were to get lab work that costed $100, you would have to pay $15, while the health plan pays the remaining $85. The out-of-pocket maximum is the most you will pay for covered health services during the entire calendar year. This means once you hit your out-of-pocket maximum, your insurance plan will pay 100% of covered health services for the remainder of the calendar year. It is important to understand that all deductible, copay, and coinsurance payments count toward your out-of-pocket maximum. This includes prescriptions too. Your premium is the amount that you pay out of each paycheck in order to be covered under a plan. And did you know that you pay these premiums with pre-tax dollars, which saves you money? When it comes to saving money on medical bills, there are other various ways that you can save throughout the year if you know where to seek care. There are different options when it comes to places to receive care: virtual visits, visiting your primary care provider, urgent care, and the emergency room. These options range from less expensive to more expensive, and if you remember tips on when to see who, you will save yourself and the plan money. Employees enrolled in any Jefferson County medical plan have 24/7 access to licensed physicians. Doctors can treat you from your phone, computer, or tablet. Consider using virtual visits for all non-urgent matters, like cold and flu symptoms, allergies, sinus infections, bronchitis, urinary tract infections, or diarrhea. If it's not urgent, consider going to your primary care physician. Visit your doctor for preventative care, height and weight check, blood pressure check, annual flu shot and other immunizations, non-emergency illnesses, coughs or the flu lasting more than a few days, or minor cuts that may need a few stitches. Sometimes you may need care fast. If your primary care physician is unavailable, try an in-network urgent care center. It will be faster and less expensive than the emergency room. Consider urgent care for sore throats, rashes, sprains, strains, small cuts, minor infections, or minor broken bones like a finger. In the case of a true medical emergency, go to the ER or call 911. Seek immediate attention at the ER for chest pain, sudden weakness or trouble talking, difficulty breathing, spinal injuries, severe head injuries, major broken bones, major burns, sudden change in vision, heavy bleeding, or a large open wound. Sometimes it is easy to confuse an emergency room with an urgent care facility. It is important to pay close attention where you are seeking care because at an emergency room, you may end up paying 4 to 5 times more for care than you would at an urgent care center.